They get that fixed. I'm going to go ahead and get started. The slides will come up as soon as they get that loaded. So I am talking about from pain to wellness, using food as medicine. So we heard this morning about the diet of, which is really significant, this plant-based diet, and taking all of the saturated foods out of the diet, the processed stuff, the sugar. And I wanted to go a little bit deeper into that, how certain foods can cause inflammation in the body, as well as cause a lot of the chronic illnesses that we see, including autoimmune disorder, a lot of the GI issues, irritable bowel syndrome, inflammatory bowel syndrome, a lot of the diabetes, chronic illness, heart disease, as well as inflammatory conditions neurologically and psychologically. So food is very important in our lives, and what we eat, how we eat, and who we eat with is also very significant. So my topic today is about pain, and this, I will go over the pathology of how and why this occurs, but this can also be relative to almost every chronic condition out there. So we're focusing in on pain, but you can substitute any other chronic illness, inflammatory disease in there as well. It would be the same treatment I would use. Okay? So just to define some terms, you might have heard in my bio, it described my training in integrative and functional medicine. So we have conventional medicine, which is this is how I was trained also as a family physician and in medical school. So we look at the body primarily in a physical way, and we treat as such with medications or surgery, interventions like that. And alternative medicine, which is the other term a lot of people use as the opposite, is not using conventional medicine, but an alternative to. And so that could be using traditional Chinese medicine or Ayurveda, which is the Indian holistic medical system, instead of medications like surgeries or pharmaceutical medications. Something completely different other than conventional Western or allopathic medicine. And then there's complementary medicine, where we use a modality to complement the conventional treatment. So for example, if somebody is going through chemotherapy, we would use some herbal therapies, or for example, if they had an esophagitis, I would use some soothing herbs and supplements to help with the lining of the gastric lining. Or if somebody had surgery pre and post-op, I would use some homeopathic remedies, or maybe some acupuncture along with the conventional treatment. So it complements it. Integrative medicine is where we combine the best of both worlds. We use complementary and alternative medicine along with medication. So if I had a patient who had heart disease or just had bypass surgery, they would be on a statin, they would be on aspirin, they would be on some kind of blood thinner. And then as an integrative physician, I would work highly on diet, highly on stress reduction, emphasize sleep and hormone balance, and work both together with that for the patient. And in integrative medicine, we value the doctor-patient relationship, which I think is essential in healing. Because if you don't trust your practitioner, it's going to be really hard to be in this very calm, open, peaceful space. And I spoke this morning during yoga about the adrenal glands, which secrete cortisol, the stress hormone, which I believe it's 100% in all of us, somewhere along the axis of that. So I'll talk about this more in my hormone talk this afternoon. But when the adrenals are secreting cortisol, it increases inflammation and decreases the immune system, which is the basis of all illness and disease, including cancer, including autoimmune disorders, including GI. So, thank you. Yes, sure. So I'm sorry? Oh, let me see if I can remember it. About all diseases, yes. Decreased immune system, increased inflammation. So you have those two components in disease and illness. And so that's why the plant-based diet works on inflammation. The elimination diet works on reducing inflammation. You don't want inflammation in your body because that's what can cause, over a long period of time, chronically, can cause degradation of the body. Good. Thank you. Functional medicine, which is up and coming, and I study this with Dr. Mark Hyman. Some of you might know him. Really fantastic, brilliant guy. They just started a functional medicine clinic, I believe, at Cleveland Clinic. And so in functional medicine, we look at patterns in the body. We look at root causes. So if I had a patient who came in with fatigue, hormone imbalance, thyroid disorder, and GI symptoms, I wouldn't treat it necessarily as 4 different entities that were happening. I would look for the root of why and what was connected and what the patterns are in all 4 of those disease entities. Because if we can get to the root of that, we go for the treatment at the root, and then those 4 conditions or illnesses or symptoms can actually get better on their own. So the way conventional medicine approaches it, and we've compartmentalized the body. There's a cardiologist, a gastroenterologist, ear, nose, and throat, neurologist, ortho. There's like a different doctor for each body part. And we don't relate the body parts. My husband is actually a cardiologist, and you can imagine our conversations. He's very conventional. At dinner time, my poor children. And he says, well, I just deal kind of like over here, like here to here to here to here. And I'm like, well, did you check their thyroid? Did you ask them about their stressors? Are they sleeping? What about their hormones? He's like, I don't care about that stuff. I just kind of, so not to rag conventional physicians because I'm married to one. That's just kind of the focus, but as a generalized functional medicine integrative doctor, we integrate the system. And I will go as far as to say, too, that we're more than just the physical body. There are emotions, our psychology, our spirituality. What about those things that make up our being? And I will say this, I believe medicine has to and will be going that way. It can't just be about the physical. It's important. That's the way people find me. That's the way we kind of wake up. Something physical is happening. But then as we peel the onion layers, we discover all of these other layers that are just as essential. Yes? So, and I believe, too, that the diets, whichever you choose, work better when you address all of the layers. I just don't believe one thing is in isolation. I don't think that you can just do yoga and meditate and then eat McDonald's and smoke. I do know yogis who do that. I used to treat a lot of patients who were completely vegan and vegetarian and were the most stressed out individuals I have ever met in my life. So I think it's more complex than just the diet. It's more complex than just the mind. So all of it has to go together. And it seems like a lot of work, but only I think initially, and this is something that has to shift in the paradigm of health, is that it's a lifestyle. We can't just extract this one thing. If I do yoga, if I take, fish oils, I'm good. Maybe, but there's more to us than that. Are we hooked up? Yay. Okay. So talking about chronic pain, the functional medicine approach is that we look at the digestive system, food sensitivities, and the liver, and detoxification through the liver. Anybody here have leaky gut syndrome? Okay. Leaky gut syndrome is, so what happens in the gut when we eat certain foods? It can either make us feel great or make us feel really bad. So when the food comes in to our systems, first of all, if you eat a lot of sugar or inflammatory foods, that's the first problem. But when it goes down into the stomach and you don't have good digestion, which might mean bloating, fullness, early satiety, belching, tells me that your enzymes to your stomach are low. So we have hydrochloric acid in the stomach to digest our food. If it's not digested, it will go down the tube eventually, and your body won't recognize it. It's like, what is that undigested piece of strawberry? What is that undigested piece of wheat or pizza? And your body will attack it. It will cause an autoimmune reaction. Leaky gut, the term leaky gut comes from a functional concept that when the intestines get inflamed, there are gap junctions, like little super tiny microscopic holes in the gut to allow nutrients to go through. They pull apart when the colon gets inflamed and allows these immune and food complexes to seep out, which can then deposit on the skin as eczema, psoriasis, in the joints, arthritis, in the lungs, can cause asthma, in the sinuses, sinusitis, in the brain, ADD, ADHD, dyslexia, dyspraxia, Alzheimer's, Parkinson's. So the lining of the brain can be very similar to the lining of the gut and act in a certain way. So you have an irritable gut, you can have an irritable brain. And there is a deep connection between what happens in the gut happens in the brain. So if I see, particularly children, I used to, when I lived in Pennsylvania, treat a lot of children on the spectrum. The first thing we would go to was heal the gut. Now, it's really hard to put a kid on an elimination diet. I mean, we would have to get pretty creative with that. But we could see that once this calmed down, their stools were normal or they were going, less diarrhea, their minds, they could sleep better. They could focus better. So the answer, I believe, is getting to the root of that, not necessarily medicating it with pharmaceutical medications or even supplements. So let's go beyond, it's a really cool thing to be all holistic and take the natural supplements, but it's still, if you're still band-aiding the issue, it's the same paradigm. So we need to shift and start to get to the root cause. Why is this happening? Why is it continuing to happen? And what is keeping me from healing? Right? Instead of looking for something to band-aid it. And because it won't really help. I'm more interested in sustainable health and vitality. And I have a lot of patients that come, I'm fine, it's okay, it's good, I'm good. We just want to be just good, okay, life is okay, it's fine. We want to be vital and what's in our purpose, right? So, does everybody understand that? Please interrupt me. I like being interrupted, actually, and asking questions real time. You don't have to wait till the end if you have any questions, okay? So, this is what happens on microscopy. So this is a healthy intestine on the left, a damaged intestine on the right with inflammation. And all of the toxin, undigested food, even yeast and fungi, parasites, could seep into the system and create toxicity in the body. So I have a lot of patients ask me about probiotics and the the bacteria. I believe Dr. Raj is talking tomorrow about probiotics. So your body, I'll just generally say, your body has a gazillion bacteria that are good for you. They help process hormones. They help regulate the body and neurotransmitters, detox the body. So a lot of things can imbalance the flora, medications, stressors, the food that we eat, inflammation. Even drinking chlorinated water can actually clean out our system. Or taking a lot of antibiotics. We see this in a lot of see this in children a lot who have ear infections. They're on this like chronic dose of antibiotics, and then they start developing these, ADD, ADHD kind of symptoms as well. They have a very sterile gut. And yeast and fungi also can overgrow. So the bad bacteria or the bad organisms can overgrow and seep into the systemic circulation. So sometimes, if you've heard of candidiasis, which can look like irritable bowel, it can look like irritability, anxiety, skin issues, that needs to be dealt with as well. Does that make sense? And you think about it, if the food does not go down, if it's sitting in the stomach, it rots and ferments and causes fungus, yeast-like symptoms happening in the gut, and it goes straight down and contributes to the dysbiosis in the colon. Karen. There's actually a functional test. So you give a substance and we can actually see it go through. It's not something you can see on colonoscopy. It won't show up on colonoscopy. And then you can generally, I don't test all the time. I'm not a big tester. I just listen for symptoms and look for patterns. So more likely than not, if I see a lot of food allergies, sensitivities, irritable bowel, IBS, chronic conditions, I can pretty much say that might be a component to it. And we can talk about how to heal leaky gut is clean up the diet. A supplement called L-glutamine can help seal the gut, as well as fish oil supplements to reduce inflammation. So this happens quite a bit, and we call it different things, but this is likely the root of what's going on. So as I said, this can start in the upper stomach. If you don't have enough hydrochloric acid, your food won't break down, and you can potentially be malnourished no matter what you eat. So the question is, why would the acid be low? Yes? Mm-hmm. Antacid, she said. Sorry? Yes. So what would be the root reason of why? So those, yes, that would be true. Antacids could contribute to an already, but what would be the primary reason the acid would be low in the first place? So, yes. So again, with the adrenal system, think about it. When you are running from a tiger, that is not a digestive activity, right? You don't like sit there and you need to sit and be calm and digest your food. All the blood goes to the food, to the stomach to digest. So it cuts the acid to the stomach and decreases the enzymes there, which causes reflux symptoms. So reflux, GERD, heartburn, is not from high acid, it's from low acid. And what conventionally is given to you is an antacid, a PPI, proton pump inhibitor, or an H2 blocker, which makes this condition worse. And it's not the treatment. So then you're on it chronically, and then you're malnourished because you're not absorbing your calcium, your vitamin D, your thyroid, iron, and then later on labs, I see these deficiencies in minerals and vitamins, and the patient's exhausted. Anybody have reflux? Yeah, how does it feel? Yeah. Yeah, it could be different for different people. So sometimes people just get a warmth in the stomach. Some people just get a burn in the esophagus. Mm-hmm. Mm-hmm. Yeah. And so I see B12s. When I see low B12s, I'm already suspecting hypochlorhydria or achlorhydria. If I see a low vitamin B12, vitamin D, and iron, and thyroid, I suspect achlorhydria. And then you're taking all the vitamin D, all the B12, it's still not going up. That's an absorption issue. Oh, I take iron, I'm so anemic. If you're not bleeding out anywhere, then it's an absorption issue. As simple as that. So you can take digestive aids like digestive enzymes, at minimum lemon and water every morning. And warm water, please no cold drinks when you're drinking. I think, are we the only country that does that? Does icy cold drink? I mean, think about it. It just congeals the digestive system. It doesn't make sense to do that. A lot of countries drink hot water, hot tea, soup to help in the digestion. You think of other countries, why do you think you have ginger with your sushi or your sauerkraut or your kimchi? They're digestive aids. And ginger is a great one. Ginger tea. I put ginger in a lot of my smoothies, for example, or with my vegetables. And that can help digest at minimum and digestive enzymes. So the contraindication to digestive enzymes would be ulcers. So you want to heal the lining, the inflammation first, and not burn a hole through your, give more acid on top of that. That's just kind of common sense. Get that? So I'm going to focus on the elimination diet, on the food portion of pain. So does everybody understand, or any questions about what I just spoken about before I move on? Yes. Oh, my other slide, yes. I'll show you. Food sensitivities, which we're going to discuss right now. So the elimination, everybody gets freaked out about the elimination diet because they think there's nothing to eat. And they're going to starve. Oh, I don't want to do that. What am I going to eat? There's plenty to eat on the elimination diet. And the thing is that the majority of our diets, our standard American diet, contains gluten, dairy, corn, soy, eggs, and nuts. We eat so much of it, it's hidden, and it causes a lot of inflammation in the body. I used to test most of my patients, do those, food test, sensitivity tests, and the top 6, those top 6, 7 foods would show up all the time. So I actually just stopped testing and just put them on the elimination diet, because the elimination is gold standard. It's 100%. The testing is not 100%, because it can show up on your test as tomatoes, sensitive to tomatoes, but you can eat tomatoes just fine. So there's a little bit, and then the thing about the testing is that a lot of things show up, and it freaks people out that they can have the yolk but not the white, and then this kind of cheese and not that kind of cheese, and maybe a little bit of farro but not gluten. It'll make you nuts. So if you ever run this test and you have a lot of things that show up you're sensitive to, I assume leaky gut syndrome. Yeah? Okay. So the features of the elimination diet: it can reduce inflammation primarily, reduces the leaky gut intestinal permeability. You can personalize this diet. The phytonutrients, the plant-based foods, heal the gut. It reduces the toxic burden. You can eat as much as you want, no caloric restriction. Promotes body awareness of foods, which I love, because when you are on an elimination, there are rules of things you can eat and not eat, and it forces you to stop for a moment. You know, sometimes we're so busy and like eating in the car, you know, on our computers or watching TV, we don't know how much we're eating or what we're eating or even care what's in it. We're just trying to fuel our bodies. And so the elimination, by giving guidelines and some rules for a time, creates a distinction. I love that word, distinction, between what it feels like to have it in the body and what it feels like to not have it in the body, to feel clean and not clean. And a lot of us don't know what that feels like. It's like the stress in the, you know, in a meditative space. Calm down. Well, I don't know what it feels like to be calm, you know, unless you create that space for it. So we can identify food triggers, and I'm going to go over how the elimination diet is done. Okay. So this is a food plan. This will be on the available for you. So there's plenty to eat, and on this diet you can have protein, provided that it is grass-fed, non-GMO, organic, free-range, lean, wild-caught gamey, wild game. So I don't know if you all can read this. It's so fish, halibut, herring, mackerel, salmon, sardines, and tuna. I would say, this is from the Institute of Functional Medicine, your tuna depends. It has a lot of mercury in it, and you have to be careful with the cans with the BPA. So I don't eat a lot of tuna. I probably would not eat that on the elimination diet if you don't know the source of your tuna. So meat, all wild game, buffalo, bison, elk, lamb, and venison. You know, I asked that question this morning about, you know, I do think there's a difference between conventionally raised meat and the ones that are pastured and or given organic grain. That might even be another distinction, grain-fed versus grass-fed. I mean, there have been some studies that have shown that grass-fed pastured meats have a lot of omega-3 fatty acids in it, almost equivalent or superior to wild-caught salmon. So I believe that there's benefit in that. I do believe that when you are heavy in the protein area, it could cause a lot of inflammation. So I think it depends. And I also think it depends on the body type you have. Not necessarily structure, but how you metabolize, because I know a lot of vegetarians who have gone into diabetes or created a lot of it. There's a way to eat vegetarian. You know, it's not just all soy and, you know, lentils. I mean, there's a way to combine the food. You know, you think about the organic, there's a way to prepare the food. A lot of, like beans, for example, have phytic acid, which is an enzyme inhibitor. And if you eat a lot of beans and you can't digest it, what's going to happen is similar to this leaky gut thing that's happening if your enzymes are low. So it just depends. And there are ways to prepare beans and legumes and nuts, for example, because the nuts also have phytic acid. So sometimes I believe that the nuts, people just don't have a problem digesting the nuts, but not the nut itself because of the phytic acid. Does that make sense? So my recommendation, if you do eat, is moderation, but you can soak the nuts in sea salt overnight and then dehydrate them the next day. So the soaking process can actually reduce the phytic acid and make them more digestible. So your food should be as digestible as possible. It's really hard to do raw. I'm not a huge raw veggie person or nut person if you have weak digestion. Sometimes salads can just really cause a lot of pain because it's fibrous. Yes, sir. Yeah, you can, but then, I mean, you're losing some of its quality the more you cook it. So you want to keep it,
So you could put it in the oven to dehydrate it after it's soaked because you can keep them for a while and you don't want them to get, moldy. So the oven is like 175 to 200 over several hours. So you can, but the temperature may make a difference in the denaturing some of the properties. Okay, so we're avoiding soy, cold cuts, no eggs on this diet, no pork, shellfish, no beef. So this is not forever. The elimination diet is this one is 3 weeks long. And I've conducted other elimination diets. I think Peggy has been in there with me with a pretty strict one of 28 days. First 2 days, green smoothies, that's it, no food. Yeah. So, and legumes, you can have, but I would soak the beans and legumes first. Same kind of processing. You can also use kombu. Do you all know what kombu is? It's the seaweed. So if you're cooking your beans, you can throw a piece of kombu in there to help break down the fibrous covering and the phytic acid. Right? And your beans should actually look really mushy. If they look whole still, they still have the phytic acid in there. So that's why we get a lot of gas when we eat beans and broccoli and all those fibrous things. One, it could be that you don't have enough enzymes in there, but it could also be the phytic acid in the food. So dairy alternative. So there's no dairy, but you can do coconut-based foods, coconut yogurt, and the almond milk, coconut, flax, hazelnut, hemp, and rice milk, as well as coconut kefir. So none of the dairy-based stuff. And the reason is with dairy and gluten, everybody's doing this gluten-free, dairy-free thing. And honestly, I don't really like to villainize food. Like, dairy's not bad, and gluten's not bad, nor are you bad if you eat gluten or dairy. So that's one thing. It's that gluten and dairy are very big protein molecules, some of the biggest protein molecules, and if your digestion is not optimal, it's going to be really hard to break it down. So these other foods are more digestible, and this is avoiding the whole leaky gut issue. Does that make sense, Karen? Yes. Yes, you can modify. So here's what we say as functional medicine doctors. If you eliminate gluten and dairy, you have 80% of the problem. So some people are like, oh, I love cheese. Okay, I'm like, what about, let's do gluten first. Then we'll eliminate dairy or find substitutes. And we're putting whole foods back into the body. Our taste buds have changed, particularly children who eat some of that school food and just kind of like processed food. And when they taste real food, they don't like it because they don't recognize what real food tastes like. And it could mean that, particularly when I'm doing this for children, it's slowly introducing foods to them one at a time. Sometimes for babies, what we do to get probiotics in them, besides giving probiotics, is actually give them sauerkraut or kimchi juice, just a tad. Yeah, and then slowly change their taste or hide it somewhere in their smoothie or something. I do that with my kids. Yeah, so if you blend, by the way, berries and spinach, it turns brown. It looks like chocolate. Like, you want your chocolate shake? It's awesome. Yeah. So ghee is another thing that you can use. Have you all heard of ghee? Ghee is primarily in the Indian culture, Indian system. It's actually very sacred. Ghee is butter, and you would want to use grass-fed butter, and it's cooked on low heat, and the lactose is actually cooked out of it. So those with lactose intolerance, and it is allowed on this diet because the lactose is, and it's delicious. Very soothing to the gut lining. So also ghee, grass-fed butter, it has a high source of vitamin K2, which is great for your bones. I actually supplement K2 in my osteoporotic patients, in my osteopenic patients. You can flavor your ghee with spices as well. You can buy it at your health food stores. I've seen it at Albert's. Are you from Evansville? Maybe Adele's would probably have it. You can also make it. So you have that farm. What's the farm here called? Seton Harvest, and there's another one that delivers to Albert's. Yeah. Yeah. There's a farm that does all grass-fed, pastured eggs are delicious. They actually do raw milk, which does make a difference in the processing, I believe, in the body. And they do the most amazing grass-fed butter. It's orange. And you can see it. When you see grass-fed food, the butter is yellow, like your jacket over there, versus that light kind of yellow, and the eggs are orange. Beautiful, it has orange like your shirt. Not quite like your shirt, but, and you can tell the difference if you break open something from the grocery store and that, yes. Make sure it's grass-fed. Because think about it, if it's not, and it's fed genetically modified corn, soy, that's going into the fat, into the milk, and going to you. So it's important when you're using oils that it's high quality. And coconut oil and ghee are the two primary oils that I use because they have a very high smoke point. So you don't want to use and cook, deep fry, and for instance, olive oil, because it has a very low smoke point. And if you burn the oils, it can cause free radicals. So you want to use something that's quite stable. And by the way, fat does not cause high cholesterol. These higher cholesterol oils do not cause high cholesterol. Inflammation causes high cholesterol and heart disease. And that is starting to shift and turn in cardiology, in medicine. My husband thought I use coconut oil all the time, and it's kind of in my culture. I'm Filipino. We use coconuts all the time. My husband's Polish, and he's like, are you trying to kill me? Like, you use so much coconut oil. Like, are you secretly, with the ghee and the coconut oil? Like, so now he shifted and changed, and we use that as our primary oil in my house. All right, so nuts we went over, no peanuts, and the oils we went over. So no corn oil, cottonseed oil, margarines, you want to stay away from those. Peanut oil and soybean oil. So a lot of the soybean, unless it says it's organic, is genetically modified. So you want to be very careful about using soy. Okay, whole list of veggies. So you can do most veggies except corn and potatoes. If you have a known nightshade issue, so peppers, tomatoes, potatoes, eggplant, nightshades can cause quite a bit of arthritis in the body. I've had many patients just come off their salsa and their pasta sauce for a few days, for a week, and they're off of their Celebrex, they're off of their Naprosyn, they're off of their their Advil. So if you tend to have joint issues, consider eliminating the nightshades. Tomatoes, peppers, eggplant, what was the other one I said? Potatoes. Mm-hmm. Corn is not a nightshade, but eliminate corn. Yes. Sorry? squashes? Okay, yeah. So fruits, most fruits, here's a caveat to this, and you might have, sometimes citrus can give you an issue, like oranges, lemons, and limes. So it just depends. If you know that you have an issue with that, you might want to eliminate that. It's not always for all people. Sometimes strawberries do too. Interestingly enough, strawberries are one of the most allergenic fruits out there. So another elimination diet that I run actually eliminates strawberries. So I love strawberries, but you might want to eliminate that. So gluten-free grains, wheat, barley, rye, oats. Oats are not inherently gluten, but they're often contaminated in the processing. So you can do oats, but they would have to say, processed in a factory, in a completely gluten-free factory, because you cannot guarantee that they're not contaminated. And sometimes if you are sensitive to gluten, you can get contamination in spices. You can get contamination in the bins, of the rice and the nuts and things like that. So if you have a known sensitivity, you might want to be careful with that. And then you can have water. Yeah, you can have water and fresh juices. That's fine. Green tea, coconut water, the nut milks that are unsweetened, but no alcohol. Sorry, no cocktail time, no coffee, no black tea. I know. All right, so here's the summary of that. So it makes sense, right? A lot of the processed foods, gluten, dairy, corn, soy, eggs, nuts. And you can eat, there's protein that you can eat. You can eat all the green vegetables. So there's no caloric restriction. You can eat as much as you want. My thing is like, eat when you're hungry, stop when you're full. Simple. I don't buy that eat every 15 minutes kind of thing. I believe in just intuitively eating and listening to your body. Right? So we talked about that. And I'll go over some of the food substitutions. So the milks, again, we talked about the rice milk, the almond milk. With the almond milk that they talked about this morning, soak your almonds first and then blend the next day. If you blend the almonds, and you can do this with any of the nuts, it looks like milk. You strain them with a strainer or a nut bag. You can also add sweetener like dates. I use maple syrup as my sweetener, or you could use honey. Questions? Yes? We're getting to that. Yes. Yes. Yes, they should be on there. We'll get them on there. Yeah. Yeah. Yes. That's okay. No. No. Yes. Okay, so the difference between white and brown rice, the brown rice still has the husk on there. And the thing with white rice is that it has a high glycemic index. I mean, you'll process it really fast and turn it into sugars, and it can increase your sugars pretty quickly. However, it's quite digestible, and in some cultures, they use that during their eliminations, like khichdi, the Indian in the Ayurvedic, because they want for it to be digestible, right? So it depends, I think, how that is. It is allowed on here because it's not a gluten grain. And brown rice is fine. There are some people who have sensitivities to grains in general. And some people, get on the paleo diet and feel really great on that. So it depends. Is it because you don't have enough enzyme and you're not digesting it well enough, or you can also soak and sprout That's the other thing, sprouting your rice and grains. So think about the sprouts when you soak them overnight. So rice, for example, you soak it, leave it on your counter, and it starts to sprout, the little seed. There's so much power in that, so much potential for that little rice seed to grow. And it's so nourishing and easily digested. So you can see there's a lot of preparation in food that has to happen that people did a long time ago that we just don't have time to do. I mean, you can buy, sprouted rice, but it's expensive. And the thing about health is that you have to invest your time. And once you may have to plan during the week, and there are certain things that you can, like fermented foods and culture foods that'll last a long time in your cupboard. But if you can start to incorporate these things into your life, it becomes second nature. It's just maybe new right now and overwhelming, but it's totally doable. So, all of those wonderful foods have an alternative, even ice cream, coconut-based ice cream. It's really great. Again, the coconut oil and ghee. And you'll notice how you won't crave quite as much as the carbohydrates and the sugar if you do crave that. Because some of it is you're just chasing your blood sugars, right? You're tired already. You need the coffee. You need the bagel. Running all day, you crash, and then you need something else to pick you up. So your blood sugars are going up and down all day long. And on the elimination diet, it often evens out the blood sugars. You sleep like a baby. You don't have the ups and downs, and your cravings actually stop. So you need to plan. I would never say, do this tomorrow. Usually it takes a week or so to plan. You don't need to go hungry. You can prepare your snacks. Read all the labels. I had a patient who said she was on the elimination and loved those blue corn chips because they were gluten-free. I'm like, darling, corn, not supposed to. But, so the marketing is really great out there, with the sugar-free, gluten-free, and not giving a thought of what if it's all of that free, then what's in it. And if you can't pronounce the ingredients, then pick it up. Yeah. So definitely eat enough food, eat regular meals. Choose organic when you can. The EWG, Environmental Working Group.org, EWG.org, has the Dirty Dozen, the top 12 foods you should not be eating inorganic. The berries are usually at the top. The ones with the thicker, and then there's the one that's the clean dozen of the foods that you can eat that have a low pesticide residue. So avocados, bananas, those with the thicker skins, you would want that. That's okay if you don't buy those organic. It can get expensive after a while, yeah? So if you need to pick and choose the Dirty Dozen. So peaches, high in pesticides. Again, the strawberries. So be careful with that. Cold-pressed oils, eliminate caffeine, and get lots of rest. One time I did this diet, I put my nurses on it, myself, and a few of my managers on a Monday. Oh, no good, no bueno. Don't do that. I usually now, after that, ask people to start on a Friday night so they can sleep and get rest through the weekend. And usually the first 2 days you could have headaches, nausea, fatigue, weird stools. Doesn't last forever. It's kind of gets worse, cleansing process before it gets better. So by the time Monday rolls around, you need to go to work, you're pretty good. So again, the fatty fish, the lamb, the buffalo, nuts and seeds. If you're sensitive to them, please soak them. Dark leafy greens like kale, the collards, broccoli, all of those things are super great for liver detoxification. So we talked about earlier. The liver can get congested when the digestion is slow. And the liver detoxifies hormones through, medications through, alcohol through. And if you're one of those or have clients and patients who are super sensitive to things, it's likely a liver toxicity, a liver congestion. But that doesn't really show up on the liver function tests, on the labs. It's something, you can test it functionally, but from a normal lab perspective, your LFTs won't be bumped. And the ultrasounds won't really show that. You can just kind of tell. When I see women, and I'll talk about this afternoon, with hormone imbalance, or even men with hormone imbalance, like estrogen dominance, they're not processing their liver through the body, they're not processing the hormones through the liver. I can already tell that there's a congestion. And interestingly enough, according to traditional Chinese medicine, the liver holds anger. Not just anger, but rage and irritation. So as a functional and integrative physician, I also look at the emotional aspect of why this is happening. Like, what is really underneath this? Like, who you're angry with? Who do you need to forgive? Like, who is sitting there in that liver? Because we can clean that out with some milk thistle and green smoothies every morning. But if you are, holding on to some anger and resentment from a long time ago that you're unwilling to let go of, you might as well just go eat McDonald's. And that's the truth. Right? And we don't talk about that enough in medicine, that those underlying emotions, those things that can get lodged in the body, but they are true and they are important to address. So not necessarily barbecuing all of your meals, using low temperatures when you cook, and certain spices. Great. And eliminating the inflammatory foods. You all know what those are. So to reintroduce, so you're on your 3 weeks, you're on day 21, and you can reintroduce the foods. You do one food at a time, and it can be the food that you crave the most. Yes. So if it is ice cream, you may want to do just milk. Or if it's pizza, you may want to do just the gluten part, like a piece of wheat bread. You introduce it, one food at a time, 3 times a day for 2 days, and see if you react. Oftentimes I've had patients, once they put their milk in their milk in whatever, or added that, they get a stuffy nose again, or they get migraines, or they have diarrhea right away. So if you react, you stop it immediately, let your body cool down, and then you can go to the next food. If you don't react, great, not a problem. Go on to the next food. So it's really hard, though, if you did a piece of cheese, pepperoni, I don't know, meat, whatever that kind of pizza. It has all of it, so you're not going to know what you're reacting to. It could be the tomatoes, it could be the gluten, it could be the dairy. So you want to be as pure as possible. Okay. If you do react, you can wait a little while, but I actually, it depends on how severe the reaction is, I would probably wait a week or 2. And even if you did react, and you kept reacting when you reintroduced it later on, you could try maybe 3 months or 6 months down the road. Doesn't mean that you'll react forever. It may mean that you just have a lot of inflammation in the body still that needs to be addressed. Okay? So I had this patient who, I put her on the elimination diet. She had this interesting rash on her thigh. And she sent me this email and said, 4 weeks since my diet change, I've lost 7 pounds without trying, and while it has presented some challenges, hasn't been as difficult as I've imagined. The biggest problems came when traveling with others who think McDonald's has plenty of healthy eating choices. Laugh out loud. I'll admit, have had fries a couple of times and have found that even though I choose the healthiest options on a menu, at least I think they are, I feel like I'm carrying around a lead weight the next day. I found that the cravings for soda came when I'm really stressed. One of the most interesting things that I've noticed in the last couple of weeks is that my feet no longer hurt when I first get out of bed. Previously, they ached so bad that I could barely walk. And it always attributed to plantar fasciitis, the therapist in me. She's a physical therapist. As far as the area on my hip, I was able to go a month without the cortisone ointment, something that has not happened in over a year. And it no longer has the burning feeling that it had for the past year. My hips don't hurt either. And I was taking at least 2 to 3 Tylenol per day for hip pain in the weeks prior to starting the diet. And I've not taken anything for pain relief for 3 weeks now. Yeah, so it is quite remarkable, this diet. Some integrative doctors, I'm not this mean, will not even see you until you've done this diet. Because so much can be healed by the food alone. And we don't give a second thought that food is that powerful. And it actually is. So thank you very much. If you have any questions, let me know. This is my contact information. And the presentation will be up on the site. Yes. Good. Thank you.